Hi, it's Dr. David Greene, founder and CEO of R3 Stem Cell, the global leader in regenerative therapies. All right, today I'm talking about treatment of erectile dysfunction in those with diabetes. For those suffering from type 2 diabetes, one of the number one complications that we hear from patients is erectile dysfunction. Unfortunately, erectile dysfunctions affects about half of men, and the incidence continues to increase by about 10% after the age of 50. So 60% by age 60, 70% by age 70, so on and so forth. It's very, very common. There was a recent study this year in an international urology journal that reviewed 48 published studies on stem cell therapy for erectile dysfunction due to type 2 diabetes. And what they found is that mesenchymal stem cell therapy, which is what we use, works fantastic for those suffering from ED due to diabetes. Now, we use umbilical cord mesenchymal stem cells, which was used in a lot of the studies that were reviewed, and just one injection worked well for the majority of men for over 12 months. Now, there were some studies that looked at umbilical cord stem cells plus PRP, and that increased the effectiveness. We've known this for years. So what we use through R3 Stem Cells clinics is what we trademarked as the regenerative trifecta. And what that means is a combination of umbilical cord mesenchymal stem cell endosomes, and PRP. So the trifecta is those three together in a proprietary formulation that optimizes the outcome for men suffering from ED, whether it's from diabetes or other. Basically, what's happening is a numbing procedure, so it's very well tolerated, and then multiple injections into each corpus cavernosa, and then an additional injection underneath the tip at the frenulum. Now, over time, it can take 1 to 2 months for that new blood flow to kick in. That's called angiogenesis. It's been extremely effective at improving a male's ability to not only get an erection, but to maintain that erection through intercourse. And it can decrease the need for various oral medications or like those injections you might have to give before intercourse, right? So that's a fantastic result. The procedure does not take very long. It's 1.5 hours, okay? Now, R3 has clinics in 7 countries. So if you or a loved one is suffering from ED, if it's due to diabetes or other conditions, we can most likely help you. Call us today at +1-844-GET-STEM. Visit us online at r3stemcell.com. Lots of educational information on there. Scroll down on the website. There is a free consumer guide download that I wrote for stem cell therapy for erectile dysfunction. It'll give you a lot more background information on the types of stem cells we use, the type of exosomes we use, and I go through the latest studies on stem cell therapy for ED. Thanks for watching.